Welcome to Mexican Crossing Lines with your host, Cindy Gomez-Schempp.
And Duke Gomez-Schempp.
You're listening to 88.1 FM KPPPLP Fargo Moorhead, where we are adding local color to your airwaves. And today's show, we're going to talk about examining the lasting effects of COVID. There's a lot of things we don't know about COVID, what it does to your body, what it does to kids, the long COVID, which a lot of countries are now identifying as a long-term disease.
Yeah, and it's something we don't know a lot about. It has been researched. It has been around that long. All sorts of people are coming down with it. There's just so much we don't know. And it's one disease you do not want to get. And to do the best about that is get vaccinated. 1, 2, 3, perhaps even a fourth time coming up soon.
Well, the thing about it is that people are talking about Omicron, saying it's milder than Delta, and that is a misnomer. I think it's misleading people into thinking that it's not as dangerous to get it. And then, of course, we have people basically saying it's inevitable, everyone's going to get it. And there's some people that don't want to get it.
I don't want to get it.
I don't want to get it. And the thing about it is, if you get it and you have damage from it, and everybody has damage to different varying degrees. For example, some people lose their sense of smell or the sense of taste.
Yeah.
And they haven't recovered it.
Mm-hmm.
Here it is a year later, and they still can't smell or taste anything.
Wow.
Is that an okay outcome?
No, it's not.
And that's for a mild case, right?
Right.
Then you never get to smell or taste again? Or what if you have permanent brain damage?
Mm-hmm.
That's a large percentage of people have long-lasting effects in their brain or their cardiovascular system, or they develop comorbidities. We're going to have to talk about how serious it is. I've got some reports from the WHO. I've got some comments from doctors, epidemiologists, and regular folk. And we're going to be listening to the take from Dr. Rochelle Walensky of the CDC and what she has been criticized for saying recently about the deaths due to COVID.
And if you're just joining us, this is KPPPLP 88.1 Fargo Moorhead. We're streaming this show. We're playing it on the radio, and we're streaming it on Facebook at the People's Press Project, or 88.1 Fargo Moorhead. We're also streaming it on YouTube at Duke 1517, and we're playing it on Twitch at A Mexican Crossing Lines. If you'd like to give us a call and leave a message on our message line, you can call 701-566-0917. The number again is 701-566-0917. You can tweet us at media_PPP. If you want to communicate through email, send Cindy an email at cindy@kpppfm.com or me, Duke, at kpppfm.com.
Thank you very much, and I hope you do follow us and send us your thoughts. A lot of people, tweet at me or email me their comments and their thoughts. And, there's a whole group of people that are anti-vax, anti-mask. They are not going to get the vaccine.
Yeah.
There's nothing we can do about it. They're not going to get it. And that's going to keep putting all the rest of us at risk.
Mm-hmm.
And then there's the people that are pushing alternative forms of treatment, which, by the way, have no proven health benefits, like hydrochloroquine or ivermectin. The latest ones, believe it or not, Duke, is Viagra and urine.
Urine where?
We're in trouble.
You're in trouble, yes.
Yes, if you're drinking pee to try to save yourself from COVID, you're in trouble.
Yeah.
But let's forget for a moment about all of the crazy people that don't want to get the vaccine. And I say crazy because when you have an effective treatment for a deadly disease that has killed over 1 million people in the United States, it's crazy not to take it. It's crazy not to do the simple, easy thing to protect everybody. Wear a mask, social distance, get vaxxed, get boosted. Simple as that.
Mm-hmm.
But let's hear from the WHO, the World Health Organization, which has now put out a statement to counter this idea that Omicron is less threatening, that it's mild, quote unquote, as people have been saying. The WHO is saying Omicron is life-threatening for unvaccinated folks, the elderly, and people with underlying conditions.
Mm-hmm.
Now, Dr. Mike Ryan, who's the director of the WHO's Health Emergencies Program, has said that Omicron represents a massive threat to those who are unvaccinated. So, if you're unvaccinated, no form of COVID is safe for you. All right?
Yeah.
There isn't, your immune system is not going to protect you from COVID. Your own natural, robust immune system would not protect you from a sexually transmitted disease. You would not go and put yourself in harm's way because you're young and healthy. You wouldn't go and contract syphilis on purpose and go, oh, my body will take care of it.
Nope.
So why would you put yourself in harm's way and contract a deadly disease like COVID? That, again, we don't know what it's going to leave you with, what kinds of problems it's going to leave you with, maybe for the rest of your life. So Maria Van Kerkhove, the WHO's COVID technical lead, said the elderly people and also people with underlying conditions or comorbidities, as they're also called, have an elevated risk of death.
Wow.
Compared to the rest of the population.
Wow, so much for mild.
Yeah, it's not mild. That is completely a misnomer. Van Kerkhove also said Omicron has been detected in every country in the world. Every country that has good genetic sequencing, and in every single nation on the planet, Omicron is already there. They've also found a new combination of Omicron and Delta called Deltacron.
Huh.
Yeah. And then, of course, there's the new variant, the French variant, that's out there. So you have to remember that for unvaccinated people, the risk is much higher if they contract Omicron, that they will become severely sick and possibly even die. It still represents a massive threat to life and a massive threat to unvaccinated people's health.
And this keeps on mutating, too, and that's because it has plenty of hosts to work through different conditions. Boom, another variation.
And Dr. Mike Ryan said vaccinated people that have been vaccinated, fully vaccinated and boosted, if they catch it, they generally will experience only mild symptoms. But people should really get vaccinated and boosted because if you have any underlying conditions, and many people don't know that they do, many people genetically might have heart disease run in their family.
That's right.
Right? You might have all sorts of underlying conditions that you're not even aware that you have. And it's going to come out during an infection of COVID. Dr. Emily Moin posted on Twitter from @EEMOIN. She wrote, I was just informed that a patient who presented with dyspnea and was found to have bilateral unprovoked pulmonary embolisms, also had quote-unquote asymptomatic COVID. In case anyone was skeptical that the boots on the ground situation is as absurd as we have been claiming here on Twitter. So here's a case of a person that has no symptoms, 0 symptoms, but they're infected with COVID. And they presented with I can't say this correctly.
Pretty much blood clots, right?
Yeah. Bilateral, meaning in both lungs, unprovoked pulmonary embolisms.
Great.
A pulmonary embolism is this person presents with an inability to breathe, shortness of breath, dyspnea, or whatever, dyspnea, and clots inside of their lungs on both sides. Now, one of these clots breaks loose, and it will kill you. Goes into your brain.
Yeah.
You don't want clots in your lungs either. That will kill you real quick, too. And that's from a mild case with no symptoms. Here's another scary statement coming out of the Star Tribune. The Star Tribune tweeted that health authorities all around the U.S. are increasingly taking the extraordinary step of allowing nurses and healthcare workers infected with COVID to stay on the job if they have mild symptoms or they're asymptomatic for COVID.
Jeez.
What do you think is going to happen?
That's horrible. It's just asking to spread this and spread it because people, it's the petri dishes, the hospital, emergency rooms. The healthcare workers have been at risk. Now when they have COVID, they're going to be treating patients with COVID and patients without COVID.
And let me just tell you that the CDC has been all over the place because, as you know, we had a 10-day isolation period that was recommended for anybody that was COVID positive, right?
Yep.
Remember in the beginning when we were like, you have to contact trace and you have to notify everyone and you have to isolate, and it preferably for 14 days, because you could still be
spreading it around.
You could still be, positive and be spreading it even toward the end. Even though that's not as common, you could still pass it on to someone. Well, employers who are, quickly losing their workforce to COVID were asking, can we shorten that time up that people are isolating? Because we need people to get back to work. And what does the CDC do? They turn around and they go, okay, just 5 days now.
Yeah.
We know that if you become infected with COVID, that your period of incubation and the period of time that you're spreading it is longer than 5 days. We know that.
Yep.
Are we supposed to pretend we got amnesia and we don't remember how long you're supposed to isolate before you go out? We're in a bad place, folks. And the long-lasting effects of COVID are not just to your body and to your mind. We are destroying our healthcare system. We are destroying our healthcare workers. These folks are breaking. They're broken. They're past their breaking point. They've been at this for 2 years. They've been at war for 2 years. And you can't fix stupid. People are still denying that the vaccine works. They're still spreading misinformation and attacking healthcare workers. Here is a statement on Twitter from Matt Smith, MD. He tweets from Arad Doc Dates. He said, family members in mid-30s with a child is COVID positive, intubated in the ICU with a tenuous neurological status. But let's continue to call this variant mild. Wear a mask, get vaccinated and boosted. So, Um, doctors are very upset. They're frustrated that people that even have mild symptoms have such terrible hospital outcomes.
Mm-hmm.
Here's another one from a trauma doctor tweeting from Trauma Adventure. Hospital workers are not okay. I am not okay. I never worked so long or hard in my entire nursing career. This is not sustainable. Every 12-hour shift turns into 16 or more because there are no staff to take over. Crying in my car before and after every shift. I just can't do this.
You know, they've been talking about that for quite a while, and so we've had these warning signs, and it's like, you know, we're not paying attention. I mean, it's like the hospital's been full, and now the staff is getting so depleted in energy and overworked, and there's no replacements. It's going to break, and it's going to break soon. And we've been seeing these warnings for months and months and months, and still it goes on. Please don't get hurt. Please don't have to go to the hospital for anything.
Right? Yeah, because there won't be anyone to help. Shematologist, who's a hematologist, tweeting from AC Way and ACWEYAND. She tweeted on 2 separate tweets about the situation in hospitals. She says, I'm now hearing that at least one medical school is asking for students to volunteer to help for COVID-19 patients without pay or academic credit while they are paying to be at school. What do you think about that?
Well, she's talk about being desperate. I've heard of they're pretty much taking anyone to do any job because there's no people there to help. You know, and it's just, that's where we're at right now, ladies and gentlemen. We're at the rock bottom of our healthcare system, and it's needed more than ever.
Don't you think that's going to affect the quality of the healthcare you're going to receive?
Of course. You know, let's have someone just learn how to shoot a needle in your arm and draw your blood one day, and they poke all the way through your vein because they've had no practice or training.
Here's another one from Shematologist. My retired physician mom just received an email from her hospital system asking for volunteers to work in housekeeping, transport, and dining because everyone is out sick.
Yep.
This is where we are right now, dude.
Mm-hmm. We are.
How are we going to maintain this?
I don't see how. Well, I do. If you get vaccinated, get boosted, quit getting COVID all over the country, quit having millions and millions of people coming up positive every day in this country, and we're going to see the need for those hospital beds go down and down and down. They keep on talking about this. Somehow this is going to peak in a week or two. I don't see how that's possible.
I mean, it doesn't seem like there is an end in sight.
No.
And frankly, if you're just looking at the math and we don't do anything about this current situation, which means we would really have to lock down.
Exactly.
And nobody wants to do that.
No, well.
We would have to shut things down. First of all, in-person school is ridiculous right now. It's stupid. It's like so many people are out sick. We talked about this in previous shows. We need to shut down bars. I mean, what are we doing right now?
Exactly.
We need to hear what these doctors, what these healthcare workers are telling us and listen and act accordingly.
Exactly.
And people are also extremely upset with the handling of all of this by the CDC. You know, the CDC was politicized by the Trump administration and manipulated. And the people that were working there, I think they violated the public trust because they allowed themselves to be manipulated, to be pressured. And they did not follow the guidance that normally would create policy, which is to follow the science and the science alone.
Mm-hmm.
So there were many missteps by the CDC. especially with regard to masking. I hear that now they are going to be recommending that all healthcare workers wear N95s.
Everybody should.
You think maybe we should start doing that now?
Duh.
But what really set people off this past week and over the weekend is the statement that came out of CDC Director Rochelle Walensky with regard to deaths because of COVID. And a lot of people are calling her remarks eugenics. Promotion of eugenics. I want you to listen and tell me your thoughts on the other side of this audio clip.
I want to ask you about those encouraging headlines that we're talking about this morning, this new study showing just how well vaccines are working to prevent severe illness. Given that, is it time to start rethinking how we're living with this virus, that it's potentially here to stay?
The overwhelming number of deaths, over 75%, occurred in people who had at least 4 comorbidities. So really, these are people who were unwell to begin with. And yes, really encouraging news in the context of Omicron. This means not only just to get your primary series, but to get your booster series. And yes, we're really encouraged by these results.
Dr. Walensky, thanks so much for your time this morning.
Wow.
What did you think of that?
Survival of the fittest, maybe?
I mean, I can see how people would think that, she was just responding to how well the vaccines are working.
Yeah.
And if you have gotten vaccinated and boosted and you're relatively healthy and you're young, you really don't have to worry that much about dying.
And I don't like that because that's really spreading around now too, where people are talking about, well, if you're vaccinated and you have the booster, you don't have nothing to worry about. And it's like, wait a minute, I keep on seeing people who are vaccinated and boosted ending up in the hospital with COVID. It's like it's they call them bleed-through cases, and they act like it hardly happens to anyone. But
it's happening
if
all the
that can
time.
happen to you, even when you're boosted. And
Oh, yeah.
she used the word that it's a series of boosters. And I'm like, series? There's only one right now, but there's more coming.
Oh, yes. We're going to have to get this every year probably.
Yeah, every 5-6 months, I think.
Well, a lot of people are very upset. Some of them are doctors, lawyers. I'm going to read some of the comments. One from Matthew Cortland, a lawyer. He tweets from Matt, BC. He says, it is encouraging, quote unquote, to the CDC director that chronically ill and disabled Americans are dying. It's no wonder that at CDC Gov has consistently refused to issue guidance protecting the health and well-being of chronically ill Americans. Our deaths clearly don't count. And it's not a small amount of people that we're talking about that have one or more comorbidities. I told you that Americans would be uniquely affected by this virus in a way that the rest of the world would not, because in this country, we have a very unhealthy population. More than half of our population is morbidly obese.
Mm-hmm.
That's a comorbidity.
Yep.
We have a huge problem with diabetes. Huge, because of the consumption of sugar in this country. So we have the same thing that contributes to the obesity, contributes to the diabetics, and that's just two.
Mm-hmm.
One of the leading causes of death in this country is heart disease, high blood pressure, a propensity for tachycardia or other heart problems. That's a lot of people.
Yeah, for sure.
And let's just look at what the breakdown is of people that have other kinds of comorbidities. The term chronic condition, in just 2 words, captures a huge swath of what ails Americans. As used in the RAND study, it includes any physical or mental health condition that lasts more than a year and either limits your ability or requires ongoing treatment. That means high cholesterol, high blood pressure, anxiety, arthritis, heart disease, diabetes. The RAND researchers used data from a national survey on healthcare expenditures to compile a chart book with the most up-to-date numbers on the costs and the prevalence of such chronic conditions. This estimate suggests that nearly 150 million Americans, that's more than a third.
Exactly.
Okay. Nearly 150 million Americans are living with at least one chronic condition, one chronic medical condition. And around 100 million of them, that's a third, have more than one chronic medical condition.
Wow.
Nearly 30 million people are living day in and day out with 5 chronic conditions or more. So, a third of our population is expendable? This is a mass debilitating event because many people will have problems, sequelae, for the rest of their lives because of the lasting effects of COVID. Here are some of the comments about what the CDC director has said. People are mad about this, dude.
Okay. Yeah.
And then there's Maud tweeting from Proud Liberal Mom says, I'm glad to know that that since I have cancer, the CDC director feels I'm expendable, that I don't have a right to live, that I'm a statistic, so that at CDC Gov can say, oh, look, Omicron's not that bad.
Yeah.
I've had cancer. I'm a cancer survivor. Why do you think that we have been holed up in our home for 2 years?
Yep, exactly. And people look at us like we're crazy, or they make assumptions that, yeah, just meet me downtown. I'll give you this thing. It's like, no, I ain't going anywhere. Especially now in the middle of this current siege that we're having. I don't want to touch anything outside this house. Even when I get stuff that's brought to this house, I'm wiping it down because I want to take the precautions of not getting this COVID.
And thank you for protecting me. Thank you for letting me know, at least here in our little bubble, that my life matters to you.
Yep. And we can do radio from our house.
Thank gosh. Okay, Ebony Jade Hilton, MD, tweeting from Ebony J. Hilton _MD, who's an anesthesiologist, tweeted, what the CDC director knows but didn't say is that for many, the neighborhood you grew up in is a pre-existing condition all on its own.
Yeah.
I can say that. I was living in
Mission City.
a section of town where all of the Mexican people lived because they wouldn't rent to us. They wouldn't sell to us in other places. And they had chemicals that we were breathing every day. A lot of the people in that area contracted lifelong asthma, such as I have, because of the place where we grew up contaminating us. The smog that polluted the air, the lead pipes contaminating your water, food deserts. You didn't get a diagnosis, but your organs feel the insult. Because, like I said, a lot of people, due to the place where they live, the food desert that they live in, the smog in the cities where they live, the lead pipes contaminating the water that they drink, putting mercury in their brains. All of these things are affecting people that live in poverty, people of color, at an outsized pace. And many of those folks have never even gotten a diagnosis. You know why? Because they don't even have access to health care.
Exactly.
Vote like your lives depend on it, tweeting from PA758758, who's a retired microbiologist, tweeted, I've lived a productive life as a microbiologist, and then a social worker despite having comorbidities. So the CDC just doesn't give a flip if I live or die? CDC just gonna label me as unwell and gaslight us into accepting deaths of our loved ones and coworkers? Yeah, I mean,
so.
that's how it feels.
Yeah, I guess so. That's what they're saying, and they're trying to put this out there like, oh, the people affected are the ones that have a lot of problems. But the rest of you, the other 2/3 of you, or other third of you, don't have to worry.
At the beginning of this pandemic, before there was a vaccine, my cousin Martina, who is 4 or 5 years older than myself, in the prime of her life, she had diabetes. And when she died from COVID, and I told some of the people around me, I had Republicans ask me if she had a comorbidity.
Yeah.
And it made her life seem to have no value.
That's right.
To those people.
Insignificant.
Because they said, oh, well, she had diabetes. I guess that means you should let them die.
Yeah, she's only going to die this week from diabetes. She died because she had COVID.
Exactly. And that's what, we have been feeling. People with disabilities, people that have comorbidities, have been feeling like we are expendable. And the CDC's director's words are not helping. At Polar Bearish tweeted, I am unwell to begin with, quote unquote. So that means my death is encouraging?
Yeah.
My household, full of elderly cancer survivors, says, thanks for the message that we don't matter at all. At Los Carlos tweeted, when I contracted COVID, I was in the tip-top shape of my life at 30 years old. 2 years later, after the mild infection, quote unquote, I now have at least 4 comorbidities due to long COVID.
Wow.
So feel free to completely disregard what happens to me if I get infected again. At Ryan, the admin boy, tweeted, number 1, asthma. Number 2, overweight. Number 3, anxiety. Number 4, irritable bowel syndrome. That's it. That's all you need.
Yeah.
Or a sensory impairment like anxiety and depression or PTSD. And for your information, being pregnant is usually considered a medical condition.
That's right.
So they might as well include that as well. Have a bad ankle? That might be included. What about a concussion?
Yeah.
So many people. I mean, you played sports.
Yep.
You've got some injuries that you had left over from that.
Yep, I know what you're talking about. And actually, if you bring up sports, that's something that's really been bugging me because they're doing the playoffs in professional football right now, American football.
Jeez.
And they keep on saying, well, so-and-so's on the COVID list. And it's like they're so nonchalant about these players that end up having COVID and they can't play the game this week and they have to substitute that person with someone else. And these are filling crowds in stadiums and having people right close to each other, and they're becoming COVID hotspots. And it's like we only care about having this stupid Super Bowl game that's going to come up because it benefits the advertisers. It benefits the corporations. It's not about the people. It's not our entertainment that makes us feel good. It's about the show must go on whether you have COVID or not.
What does that tell you about our priorities as Americans? I mean,
They aren't our priorities. The priorities being put upon us that we're falling into like shadow.
don't buy it, folks. Save yourselves. Save your family members. Save your children. Here's another tweet. This will be the final one on this topic. From Victoria Bronsworth, who is an award-winning journalist at VAB Vox. She tweeted, I would add that as I heard the CDC director dismiss the deaths of disabled and immunocompromised people on Monday, I was overwhelmed with rage again toward unvaccinated people and how much damage they have done.
Exactly.
Yeah, I mean, these are the effects, cause and effect. For every action, there is an equal and opposite reaction. You cannot put so much hate and stupidity and anti-vax and anti-max BS into the world and not expect that it's not going to have an effect. It's going to have an effect on our healthcare system, on our teachers, on our frontline workers. It's going to have lasting effects for decades and decades to come. We will never be the same. We will never be the same societies. We will never be the same people coming out of the pandemic as when we went in. And that's something that we just have to accept. There is no going back. The new normal is living with this pandemic and working to protect ourselves from ever having to get it. And if all of this wasn't bad enough, there are scam companies that have popped up that are providing false negative test results so that people can go back to work or fly or do whatever the heck they need to do with fake COVID results.
Wow.
This is a report from Wink News, a company called Center for COVID Control, with testing sites all around the country, has been administering fake COVID tests. This is a news investigation that began in Florida, and you should know that the Attorney General in Florida has been notified of this scam, but has yet to respond to requests for comment about this story. Take a listen.
Erin Cates is a wife, okay? She's a mom too, and she's COVID positive. But see, she knows that now. She didn't know it when she got in this line. Erin, her husband Doug, and their 3 kids were in search of a test when they saw the signs along 41 in Bonita Springs.
There was just kind of like, almost like an election advertisement type sign, like a plastic sign that sits in the ground that says COVID testing this way. And I think it even said free COVID testing.
In line, they were told to grab one of these doctors' clinical lab cards, scan the QR code, and enter their names, address, a picture of their driver's license, and all of their personal insurance information.
When we went to CenturyLink, they didn't need all that information.
But the Cates filled out the card anyway. While they were in line waiting for a test, they got a notification that their results are ready. Results of a test they were still in line to take.
We got an email for each of us, all 5 of us, both of us and our 3 kids, saying that our rapid test came back negative.
The Cates told me other people in line got the same exact message. Erin and Doug did not like that one bit.
So I confronted the man. I asked him how this happened.
So they emailed Wink News, and I started to investigate. First, I tried to call Center for COVID Control. That's who sent Erin and Doug the notification that their test results came back negative.
You are currently caller number 121.
It said our wait time was 5 minutes, and then 6 minutes, and then 8 minutes. I gave up after 40 minutes. I was getting nowhere. I went back to the card the Cates filled out, looked up doctor's clinical lab. I found one ending in .net and another ending in .com. I called the .net number first. A spokesperson from the Miami-based company told me. So the Doctors Clinical Laboratory Services that is using your logo and name on the west coast of Florida in several locations is not a part of your entity.
Exactly. It's not a part of us at all.
So when I looked for a number to the .com,
Oh my God.
Okay. Now remember, these tests they're administering are free.
Yeah.
They're flooding the zone with negative results for people that are out desperately trying to find a place to get a test. Because, we have tests are in short supply. Over 1.5 million people a day and those are the people that have gotten tests and got the test results back, are reporting infections. So we're going to have 1.5 million maybe 2, 3, 4 million people a day contracting it.
Wow.
And these folks are providing testing sites all around the country and just sending people negative results.
And stealing your information, it looks like to me.
I wonder what they're going to do with that.
Yeah.
Because they're taking people's insurance information.
I know. And I'll talk on the back end of the next one.
You think that they're going to bill for those for insurance companies?
Well, actually, right now, in fact, it was announced that if you've been paying for at-home COVID tests, the federal government will reimburse you starting Saturday. And I'm like,
what?
Up to 16 tests a month. And I'm like, what reimburse you? You know, it's like I know they're talking about actually having a website where you can sign up to get a free at-home tests for your households. And this is like, what's with this? And you're supposed to deal with your insurance company, but it might have something to do with that.
Okay, let's listen to the next clip.
So the next day I tried again. This time a single page filled the screen. The message, quote, "The patient you are trying to verify has been tested. If you need a copy of the report, call our lab," end quote. And there's a phone number. I called and heard this.
Thank you for calling Center for COVID Control.
Recognize that message? It's the Center for COVID Control. The company website says it is based in Illinois, operates more than 275 locations in 29 states, boasts free rapid COVID tests, detects Omicron, is highly effective, results by the end of the day, no appointments necessary. The Center for COVID Control says it is, quote, partnered with a CDC-approved and licensed lab, end quote.
I just want to pause to talk about the Omicron variant because there was a report that came out that the tests that we have available for COVID were not able to detect Omicron in a lot of instances.
That's right.
So they were telling people that it's not enough to take the rapid test. You have to get the PCR antigen test as well.
Yep.
And even then, if you have symptoms and you're getting a negative, assume that you have it, assume that you're positive, and isolate because Omicron has not been detectable on a lot of tests. So this one is telling people that it's highly effective on Omicron, and they're not even testing people. They're just telling them that they got a negative test. Okay, go on.
Good, it sounds good, but is it legit? So I went out to the testing site in Bonita. Look, no social distancing and about 15 to 20 people in the lobby. On a table, those same cards the Kates filled out. And only one person in the entire facility who told me that he started working there 4 hours ago. You don't know the name of the company that you just worked for right now?
All I can tell you is the man that should be able to answer all the questions should be back anytime.
Tyler Blackwell looked the part.
Are you a nurse? Like, you have scrubs on right now. Are you like a registered nurse?
I am not.
Where'd you get the scrubs from?
You can buy these things anywhere, man. Walmart, Target.
He told me he has no medical training or expertise. People so they can stick them up their noses.
It's criminal. It's infuriating. I hope it gets shut down fast.
And the icing on the cake, a tip jar. I don't think you heard me. A COVID-19 testing site with a tip jar. It says tips for Tony. Blackwell told me that Tony was a man. It turns out Tony was a dog. A tip jar for Tony the dog.
So, you heard how I tried to call the Center for COVID Control. I emailed them too. So far, no response. I reached out to Florida's Attorney General as well. She did not get back to me either. But her office has issued a consumer alert warning Floridians to take precautions.
Take precautions.
And of course, you know, Ron DeSantis had a stockpile of over 1 million tests that he left in a warehouse during the 17 days that he disappeared.
Yep.
And he let them expire. It's like they don't want people to get tested.
Oh, yeah, it seems that way.
It's like they don't want people to know if they have Omicron or Deltacron or whatever form of variant has given them COVID so that they can't stop the spread.
Yeah.
And folks, there is an agenda. There is a reason why people are trying to keep you sick, trying to keep this pandemic going. Some of it has to do with political points to try to make the current administration look bad. But at the end of the day, it is just pure evil to keep our country sick, to keep people from knowing whether or not they've contracted a deadly disease, and to tell us that we're expendable or that we don't care what the long-term effects are going to be to anybody, including children, because it's a milder version. Don't buy any of that nonsense. Do what you and your family need and deserve to keep yourself safe. Don't contract this deadly disease. You don't know what the long-term effects of COVID are going to be, and you don't want to know. Protect your family. Keep your kids safe. Hug your loved ones. And stay at home if you absolutely can, because our healthcare workers cannot handle any more of what we have been dishing out for the past 2 years. Thanks for listening to A Mexican Crossing Lines with your host, Cindy Gomez-Schempp.
And Duke Gomez-Schempp.
You're listening to 88.1 FM, KPPPLP Fargo Moorhead, where we are adding local color to your airwaves. God bless. Good evening.